of participants on. So good afternoon, everyone. It's great to be presenting here for Oncology Grand Rounds and to be back in my home territory. So it's nice to see everyone on the line and recognizing a number of names. So for those of you who don't know me, my name is Lisa Prospero. I'm the director of the Practice-Based Research and Innovation Portfolio at Sunnybrook, and I'm currently the operational lead for Can Health for Sunnybrook, and thrilled to be presenting with two of my colleagues from Can Health, and I'll get them to introduce themselves. So Stephanie? Oh, you're muted.
Not a meeting until it happens at least once. Hi, everyone. Thank you, Lisa and team, for inviting us in today. We're really excited to be here and to be talking to you about the Can Health Network. As Lisa mentioned, my name's Stephanie Ebreo. I'm the manager of operations with Can Health, and I'll throw it over to Alex.
Hi, everyone. I'm Alex Gilbert, Director of Operations and Business Development. And as Stephanie said, thank you so much for having us today.
Great. Thank you to you both. So a little bit about what we're going to chat about today. We wanted to give you an overview of the Can Health Network. So Stephanie and Alex will give you a soundbite of what the network is, how it works, and if you have an idea what to do. We'll talk a little bit about how Can Health supports edges. So Sunnybrook is considered an edge through leading innovation and funding. And then looking a little bit about exploring opportunities through Can Health that might support your teams and understanding the processes and next steps. So if you have an idea or you want to connect with me or for more information, what to do at that point. So I think at this point, I'm going to pass it to my colleagues to talk about Can Health first.
Awesome. Thanks so much, Lisa. Hoping this presentation will be a little bit more conversational. So if any questions come up throughout, please feel free to interrupt me. Otherwise, hoping to get through this in the next 30 to 35 minutes and leave some good opportunity for discussion, question and answers at the end. I will start the presentation by including a very shameless plug. So for folks on the call, if you wanted to connect with us, we'd love that opportunity. We've included our Twitter and LinkedIn handles at the bottom. And just want to flag that we do plan on taking screenshots today to post on social media. We think that this is such an incredible opportunity for us to come and talk to you folks. So if anyone has issues with being screenshotted, feel free to turn your cameras off. All right, so for today, I think Lisa kind of painted a good picture in terms of what we want to do, but as a quick agenda, we'll go into the opportunity that we see at Can Health and provide a bit of context on the current environment and sort of what led us to the development of Can Health and our mission. We'll go into the mission objectives of Can Health a little bit more deeper, and then provide a bit more context on how we work. So we'll introduce you to the team. You know, what do we keep saying? We keep saying edge. What do we exactly mean by that? What role do our edges play in our network? And then provide some examples on some projects, both across the network and specifically, Lisa will go into a deeper dive on the projects we posted at Sunnybrook. Lots of questions also tend to come up on procurement. So we have a quick slide to hopefully answer some of the big burning questions there. And then we'd love an opportunity to talk about next steps. So if this opportunity with our network is something that might be of interest to folks, what does that look like and how might you get involved? All right, so to set the stage in terms of the opportunity, so we at Can Health see there's a huge opportunity with health tech and that it's representing a $250 billion global market. And this is an opportunity that we really want to capitalize on from a Canadian perspective. So the purpose of the Can Health Network is to ensure that Canada and Canada's talent leads this new healthcare economy. You know, historically, we know that healthcare spending continues to rise at a rate of 1.5 times the rate of the GDP. And historically, we've seen healthcare as a major cost of the system, which is true. But if we were to provide opportunities for Canadian talent to lead that opportunity, then we think that we're really excited about the opportunity that this lies for Canadian health tech to actually drive GDP and not just be seen as a cost to the system. So when looking at, again, a little bit more of context setting, we know that Canada is great at launching health tech companies. There's no shortage of talent within Canada, plenty of accelerators and incubators across the nation, spinning out some really good innovation and technologies. What we do also see though, is that there seems to be a gap. So we have a lot of these great startups, they start up small, they become a smaller to medium-sized enterprise, but we're lacking the support to traverse that gap. So how do we get our Canadian companies to go from medium size locally to a global enterprise and scale both nationally and internationally? And when we look at and try to understand what is that gap, what's feeding into that gap, what are the factors that we want to try and attack, there's three major pillars that the Can Health Network has identified. One is financial support for these companies, so access to sophisticated capital. What we see in a lot of cases is our great Canadian companies tend to look elsewhere, primarily the States, for that sophisticated capital. The second would be outdated policy. So there truly is a lack of incentives for operators to adopt emerging tech. We see a perfect example of this is with virtual care and OTN, for example. Pre-COVID, there weren't any billing codes associated with healthcare providers being able to bill out any virtual care support. And with COVID, with policy opening up and billing codes being introduced to the system, we see other virtual care providers and opportunities that are just flourishing for that type of provider. And then the third would be the receptive marketplace. So we know that the Canadian healthcare system is sparse, siloed, and very hard to access. And this is really the third pillar here, the receptive marketplace, is the one that the Can Health Network has really been focused on over the past year and a half, and the one that we continue to try and develop. So not to say that in the future we might try and tackle the other two. Right now, it's creating this receptive marketplace is where our focus lies. And so this slide is really just meant to depict that if we were to compare us to our southern neighbors, we have purchasing power of about 37 million people total, which barely equates to just California alone. So in order to give our Canadian companies a fighting chance, we really need to do a better job of unifying our national market and bringing healthcare operators and players across the nation together in order to give our companies a fighting chance. So with that, that's what Can Health is really trying to do. So when we think about the solution that the Can Health Network is trying to provide, it's creating this receptive marketplace and this scaling group for our Canadian companies. So we do this in three major ways. There's sort of three major themes that the Can Health Network focuses on. One, as I just mentioned, consolidating the network or consolidating the market. And how we've done that is creating the Can Health Network. So I'll get into a moment, but we have edges. We know Sunnybrook is one of our edges. We have edges across Canada from coast to coast to coast, who are meant to represent the buying power, but also the demand across our entire system. Next would be Can Health aims to provide access and insights to our Can Health companies. In a lot of instances, we know that these companies are coming up with great solutions, but in isolation, outside of the four walls of a hospital, for example. So what we're trying to do is connect these companies into our edges with actual end users and provide them with access to data, patients, and insights that they otherwise would not have. And then finally, we want to accelerate procurement and scaling for these Canadian companies. I'm sure it's not lost on most folks on the call that procurement cycles in Canada can be quite long. And unfortunately, a lot of our companies just don't have the luxury of time. So, selling into one edge or one hospital, for example, can take anywhere from 3 to 6 to 8 months in some cases. And once they, ideally are successful with one hospital, they then need to repeat that process over and over and over again. So these are the three areas that the Can Health Network is looking to address. Now to take a bit of a deeper dive in terms of how the Can Health Network works, we thought we'd start by addressing a couple questions. So I know Lisa was hoping we could clarify for the group how Trillium Health Partners plays into the Can Health Network. So that's a question of funding. So our funding comes in through our regional development agencies through the federal government. The Ontario region is funded by FedDev, and Trillium Health Partners is the fund holder of that grant. Trillium Health Partners is also the Ontario region lead edge. And the connection here is Dante Mora, our fearless leader. Dr. Dante Mora is the chief of staff at Trillium Health Partners, and the Can Health Network is truly his sort of brain baby. So he started it here at Trillium and brought on our team. Won't spend too much time on this slide, but just sort of wanted to paint a picture in terms of what it is that our team is trying to do. So we have Gary Ryan, our executive lead. He provides network oversight and that procurement expertise. He has been deemed our PhD in all things procurement. As you know, or as we tend to see a lot of burning questions come up through all of our partners about procurement. So he provides some good guidance there. And then we sort of have broken up the team into two major houses, if you will. On the left side of the house, Alex leads our operations and business development. So this is where we support our edges in project selection and project management, as well as providing market insights, coaching, and support to our companies as well. And then sort of on the right side of the house, we have Kaylin Rogers leading all of our communication efforts, government relations, network expansion, et cetera. Okay, so now hoping to talk to the group a little bit about what is an edge. So an edge can be any public or private organization that delivers care. In most cases in Ontario, majority of our edges are hospitals. We do have two private edges as well. SC Health, which is home care, and Prism Eye Institute is our second private edge. In the West, we know a lot of our edges, or just the way that I guess functionally they're set up out there, it's regional health authorities. So we have 4 edges representing all provinces in the West. So Alberta Health Services, Saskatchewan Health Authority, Vancouver Coastal Health, and let's see if I forget the 4th. Let me cheat here. What am I missing, Alex? Well, anyways, we'll get to it. And then we are looking to also launch our Atlantic region, which again is a mix of hospitals, regional health authorities, and some private players. So an edge's main role in the model of Can Health is to provide, is to establish the demand. So we want to understand what are the needs across the healthcare system, and we look to our healthcare operators or our edges to tell us. So what problems are you facing? What are some opportunities you see that can be solved by technology, a solution, a device, et cetera? And then edges are the sort of hosts of these projects. So an edge comes to us and says, we have problem X. We help to identify the best Canadian company that could potentially come in and solve that problem. We bring the two together in a 3 to 9 month project. We refer to them as commercialization projects. And this is where the edge provides access, insights, and data, depending on the nature of the project, to the company. The idea being that this opportunity, this project, will allow the company to iterate and enhance its product to ensure optimal market product fit. And maybe, I don't know, Lisa, should I pause there, or do you think that a decent job at covering the edge? You can always leave questions till the end as well.
Yeah, I think you're okay, Stephanie, to go ahead.
So really quickly, just wanted to give the group a sense of the network that you are a part of. So in the Ontario region, as I mentioned, Trillium Health Partners is our lead edge. We have 12 edges in Ontario. And then in the West, our lead edge is the Saskatchewan Health Authority. And then we are in the process of lifting our Atlantic network, and you can see the members all listed there, with Horizon Health Network being our future lead edge in the East. So at a high level, the purpose of this slide is really just to sort of paint the picture in terms of what the journey might look like through the Can Health Network as an edge. So As I mentioned, sort of step one there is the network identifies the most promising needs. So we work with folks like Lisa and potentially others on the call to identify what needs you might have, what are some challenges or opportunities that you would like to solve with a Canadian solution. We then work with you and the market to understand who are the companies out there, who are the best Canadian companies out there that we could potentially bring in to address this need. And then I know this question is probably on everyone's mind. There's also funding available. So the CanHealth Network does de-risk these projects by providing funding directly to the edges as a sort of incentive to take this leap of faith, if you want to call it that, to allow a company to come in, work with you. And there sort of be a bi-directional relationship there to help enhance product features. And provide opportunities for that company to really optimize their product market fit and be as competitive as possible on the marketplace. Once demonstrated the value, so we go through this project, ideally the project goes well, the company was able to deliver in solving the edges problem. The entire network actually then has access to potentially buy that product as well. So I'll get into this in a second in terms of our procurement approaches. But this is sort of part of our secret sauce in terms of how we provide opportunities for companies to not just be potentially purchased at their host edge, but across the entire network. And then we see that in a perfect situation, once a company is able to scale across the network, they would then have the ability to compete not just nationally, but most importantly, globally. I know this question comes up a lot as well. So what makes a good commercialization project? I think the most important point of this slide that I'd like to sort of hone in on is that CanHealth does not tend to work with companies that are still in their sort of proof of concept phase. These are companies that are a little bit more mature. We don't take on projects that are clinical studies or research studies. They're really meant to be working with companies that are more mature, have a good product already on the market, but just looking to enhance and tweak alongside the edge. Typically, the project length is between 3 to 9 months, and the project does not depend on factors outside of our control. So, for example, in some cases, if the successful scaling of a company may require a change in policy, those are not the types of projects we're trying to tackle today. Really quick, I did want to mention CanHealth is very clear on how we define our levels of success. And if I go back to our original mission, our mission in life as the CanHealth Network is to scale and commercialize Canadian health tech companies. So in the event where either the company fails to prove a benefit or demonstrate its value, or if the edge decides that they don't want to procure, we consider that a fail. Level 1 success is when the host edge, at the end of the project, are happy with what they see and do decide to move forward with purchase. And then as you go up the pyramid, regional, national scales take us up the pyramid with the event or with the primary goal of international scaling. So not just having the company scale across Canada, but abroad as well. Apologies for the slide looking a little funny here, but just wanted to talk a little bit about procurement. And again, if folks have questions, feel free to interrupt, but we do get a lot of questions on this topic. So again, going back to our main goal in life is to scale Canadian companies across the national network. And the way we do this is through innovative procurement approaches. So if we were to take a look at different procurement tools available to folks, we know RFP, so that's meant to be the first one, is the option there. So when a hospital is looking to purchase, they would post out to the market and say, we're looking to buy a solution that solves X. In the case of CanHealth, for all members, when you agree to be a member of the network, you actually agree to join our informal buying group. And what that is whenever one of our edges decides to move ahead with a procurement, the RFP actually lists all of our edges across the network. That's not to say that every edge is going to buy every single product that we go to market for. But what it does mean is if there are other edges across the network who share the same need and have budget to buy, they have the option to exercise the RFP. So this is really how we cut down the sales cycles and procurement processes for our companies. They actually have access to then go and sell to multiple healthcare operators across the country. And the Can Health team supports this process. So a bit in a second, I'll go into a case study of our first national RFP that we've launched. The Can Health team has supported the edge with the procurement activities, ensuring that the process is open, fair, and transparent as per legislative requirements. And so the next two slides are really just meant to show all the different projects we've launched to date. I'm sure Lisa will share these slides for the folks who are interested, but all the examples are listed here. So Trillium Health Partners, SC Health, Sunnybrook, and Sinai have all engaged in a minimum of 2 projects, which has been great to see. And then here are the remaining. So there's been a lot of work done in the past year and a half, and we're coming up to the end of our fiscal year in a couple of weeks here with a lot of projects coming to a close. So very excited. And then finally, Lisa was hoping we'd share a bit of a case study. So one of our projects, this is one that we're really excited about. It's with a company by the name of CMAR. So they're a physician credentialing and reappointment system meant to be leveraged by healthcare operators, medical affairs departments. It's a business line within the Sinai Trust. And the host edge in this case was Sinai Health Systems. So here we know that CMAR's, despite its years of success and its ability to break into hospitals both in Ontario and Quebec, we're really struggling with adoption across Canada. So what we did is, through the Can Health Network, we united that market demand and we provided access and opportunities for CMARs to understand more intimately the requirements of other jurisdictions, which allowed them to enhance their product, enhance their features and just be more competitive on the market and just essentially to get their name out there to other end users outside of these two main provinces. They were able to maximize their product market fit. And we're happy to share that one of our edges in the East, the Horizon Health Network, is actually the lead edge in this procurement. So they have launched a national RFP for a physician credentialing solution, which brought together 7 edges across 4 provinces who have come together and sort of formed the RFP committee, and that they are all looking to buy today. So they work together to hash out the requirements. Again, all edges will be listed on the RFP as potential buyers, but we actually have 4 edges that are looking to buy today. So again, with any RFP, we post it to the market and anyone can apply. CMARS, of course, was one of the applicants, and we are in the process now of evaluating all of the submissions and hoping to come to a decision and engage in contract negotiations by the end of this month. So really looking forward to see the outcomes of this one. And then Lisa, I think I'm going to throw it over to you to talk about the projects at Sunnybrook.
Great. Thanks, Stephanie. So I just wanted to give you just a summary of 2 of the projects, just to give you an idea of how this works at Sunnybrook, that we completed one and are just at the tail end of the other. Next slide, please. Thanks, Stephanie. Now, in terms of the team at Sunnybrook, the executive sponsor for this initiative is Ruth Tager. I'm the operational lead. We have a financial lead as well, Leslie Lamb, so we work very closely with the financial department. Legal lead, Sophie McCrae, and then our Can Health team that we work very closely with in terms of our project planning and other inquiries, Stephanie and Michael. Then each of the projects has customized clinical leads depending on what the project is, and I'll speak to that when I speak to the 2 projects. And then we have industry leads, which would be from the particular company that we are partnering with. Next slide. Now, before we get started, just a few points. So if you have an idea, and this is where I can help, and I call these our discovery conversations that we can have with the different teams. You have to make sure that the project is eligible, so it cannot be in a research and a development phase. As Stephanie spoke to it, it has to be something that is commercialized already. There has to be a financial commitment from the clinical team, meaning that there are funds available and it's been approved for purchase if the project is successful. And that is part of the procurement. So we're calling it a pseudo business case where there's sign off from the senior leadership of that clinical program. There has to be a dedicated clinical project lead, and I work closely with them as well as with Leslie Lamb, who's our financial lead, because we're working closely throughout the project. So we need a clinical lead as well. Then there has to be sign off from the executive sponsor. So that's through Allison, our CFO, and then the clinical program leads. And I'll speak to this as I show you the two projects. And then we go on to agreements. So very formalized project charter and various collaboration agreements that we go forward with. Next slide. I wanted to share with you two examples, great stories from 2020 that we just completed. The first one was a result of the pandemic, Precision Biomonitoring. This company is actually a company from spinoff from the University of Guelph. Originally, their end product was looking at environmental pathogens, and they pivoted their work to develop a point of care rapid test for COVID-19. So they partnered with Dr. Kozak and Dr. Mubareka to offer their expertise in the final development of their rapid point of care test for COVID-19. Now, this particular project was a little bit different than what Stephanie presented, and that was because of the pivot with the pandemic, because it wasn't commercialized yet in terms of the new product, but it was the work of Dr. Kozak and Mubareka that was integral to having them receive Health Canada approval. Now, through the project funds, we were able to secure funds of close to $96,000 for Dr. Kozak and Mubareka to support this work and their lab. Next slide, please. So in terms of the outcomes, I spoke to the project charter. So there were KPIs that we listed and detailed early on in the project. They were all successful. So by the middle portion of the slide, you'll see some of the outcomes. And in terms of the partnership itself, it allowed the company, the Canadian company, really to leverage the expertise of Dr. Kozak and Mubareka to get their project to move forward and their product to be approved by Health Canada. Now, just a little bit of a caveat here. We knew early on that Sunnybrook was not going to purchase this particular product because of its volume. It's smaller. We do large volume testing, but that was agreed upon and signed off even before we started the project. But this particular product will be used in remote locations and in private companies. So we were happy to partner with them as our contribution. Next slide. The second project that we are just on the tail end of completing, and this is more classically of the process that we would follow if you have an idea or a project. And this is Moleculite. Some of you might have heard this already because it did originally come from development at Sunnybrook. Now, the Moleculite device is helping our complex wound service care team at Sunnybrook to use an innovative non-invasive imaging device to better treat patients with complex wounds. It uses fluorescence imaging to detect bioburden. And the two clinical leads are Tracy Desgupta and Dr. Shar Sharoki. And we're in the procurement phase, and the funds acquired are to support the complex wound service integration of the device. So that was the overall goal, and we were able to secure $98,000. The funds to secure that we secured are primarily to support a project lead project manager that we had throughout the integration project. And there are also funds to support the complex wound service team to participate in this work. For example, the advanced practice nurses, the workload specialists, the statistician, so the various funds. The important piece that I want to note here is that for those individuals that we supported that were encompassing this as part of their work already, so their salary is already covered in a budget line, we're able to protect those funds for use within the project. So we were able to secure funds that will be used to purchase the devices at the end of the project, and that's why we're in the procurement phase. Next slide. Now, these are a bit of the outcomes that I wanted to share with you. Again, KPIs from our project charter that we put together in terms of what we wanted to see. And just to let you know that the project charter is something that we co-create with the company. So everything is done in complete collaboration. The outcomes were very successful in terms of what we were looking for. So we had the outcomes that we had stated earlier and then compared those to our KPIs. And then we have a statement here from the Moleculite team, because this really provided them the opportunity to work with an acute care setting. They were primarily distributing in the United States and more for ambulatory settings. So we're really looking to see how they can, how they would fit in within an acute care setting. Next slide. Oh, and Stephanie, I think I'll pass it to you for this and then back to me, and then we'll open it up for discussion.
Awesome, thanks, Lisa. So for anyone on the call who might be interested in exploring opportunities with our team at Can Health, this is sort of what the process would look like at a high level. We encourage you to reach out to Lisa and her team to identify some problem statements. So what are some challenges you're looking to solve? Understand what the solution requirements would be of a potential Canadian company that we would invite in for the project, and then work through those procurement pre-approvals and the pseudo business case that Lisa mentioned. We then have a project proposal document that we would encourage you to fill out just to provide our team with some insights on what you're looking to do for your project. And then our committee at Can Health gathers all those project proposals and either provides feedback or moves right into approving the project. We then will lead sort of the company selection portion. So looking to the market to see what Canadian companies are out there, and also sort of searching through our own database that Can Health has been building up over the past year and a half to help the Edge identify the best Canadian company. I will note at the end of the day, we always say the market dictates what company comes in, so it will always be left up to you and your team at the Edge to select the company you want to engage with. And then the really fun, exhilarating stuff, the project scoping and agreement sign-offs that everyone loves, and then project kickoff. And then with that, I will turn it back over to you, Lisa. I think that's the end of the deck.
Great. Could you just flip it to the next slide, if that's okay? Oh.
I don't know if I have another slide.
Oh, okay. Yeah, that's fine. So at this point, we wanted to present for half an hour, but we wanted to really open it up and have this more of a discussion forum for any questions, since we have Stephanie and Alex here who can speak to the details about Can Health, and then I can answer any of your queries. And I also invite anyone to connect with me post this session as well. There are a couple teams in oncology that I am connecting with already. I've presented to program council and to the medical oncology team already. So we had some individuals reach out that we're just having some exploratory discussions. So with that, I'll open it up to everyone to ask their questions or comments. Antoinette, do you use the chat box or? No questions, comments?
Hi, it's David Huang from Lab Medicine. Thanks for a very interesting presentation. So for these kinds of projects, I mean, is it sort of limited to one company? I mean, we're thinking about some projects in labs that would potentially, require 2 or more companies to be involved. I mean, is that a possibility for, or are you sort of looking at specifically only one company at a time?
I would say, David, you're the first one to bring this up. So far, none of the edges have proposed multi-company projects. I think we're open to the ideas. So if you do have one, please do bring it forward. I'd be really interested to learn more about it.
Okay. And second question then is just in terms of dollar value. I mean, both the Sunnybrook projects were about 100K. Is that the typical range that's available, or is that potentially scalable depending on the size of the project?
Typically, David, it's between 25 and 125K per project, depending on the nature and scope. So.
Okay, no, that's helpful to know. Thank you.
Any other comments or questions? I'm taking silence as no.
I guess we just covered all the bases.
I know, we covered everything. No, but I do find that we present and then people go away and they start thinking about ideas. So I really invite everyone, just reach out to me if you're not sure, if you have a question. And if I don't know the answer, I'll reach out to Stephanie and Alex. And I'm happy just even to book a small chat and over Zoom, and we can chat about an idea that you might have. So please feel free to reach out anytime.
And just for a timeline perspective for folks, we are aiming to launch sort of our next cohort of projects in April. And as you can imagine, there is a lot of pre-work that needs to go into it that is mainly supported by the CanHealth team, but some work to do on the edge as well in terms of identifying your project. So happy to jump on a call if anyone else has other questions. But I'm sure Lisa has it covered.
Yeah, and I'll say the funding is on a first come, first served basis. So if you want to make sure to secure as much budget as possible, please do submit early.
Okay, so with that, I'm going to give you back 20 minutes in your day. And again, please reach out and we can send these slides to Antoinette and she can share them. Okay, thanks everyone. Have a great day.
Thank you so much for having us, everyone. Thanks, Lisa.